All right. Hello, everybody. This is Jabri, and this is the first of many different interviews off of my short little interview documentary series that I'm posting to YouTube. Just really interviewing local people in the communities of the countries that I'm in while in Africa. So, Kenya, Rwanda, Tanzania, and Zanzibar. And today we have our first interview, who is no stranger to me. I introduce to you Kopa.
Hi.
You have to come over here. This way, the camera's right here.
Yeah.
Okay. All right. So introduce yourself to the camera.
Hi, I'm Kopa. I've been working with an organization called GVI Global Vision International for like 2 years now. That's where I met Jibri. And I've been working on a healthcare career since 2009, so 5, 6 years now. Yeah, I'm
Okay.
from Kenya.
What part of Kenya are you from?
I'm from the coast region, Mombasa, but I'm in Nairobi trying to sort some things, but I'm from Mombasa.
Hmm.
Yeah.
And how far is Mombasa from Nairobi?
In hours, from Mombasa to Nairobi is minimum of 8 hours when take bus, but with the plane it's 45 to 50 minutes.
Okay. So we'll jump right into the interview. Let's grab a questions here. Okay. So, Copa,
Yeah.
what impact has the HIV/AIDS virus had in your life and in your community?
Um, I have two relatives who have died with HIV/AIDS. One is my auntie and one is my uncle. So that's the impact which I've been facing. And also, so my auntie left two kids which are also positive and they're living while they are positive. And also, I've been working with HIV clients for the past 2 years, just helping them to cope with the environment, try to educate communities on to stopping stigma, try to move vaccines from the district hospital to just small hospital, which they call it dispensary, so that they can access the medicine in an easy way without having to travel long journeys to get the vaccines. And this has helped a lot with the community where I've been working, because now like there's a lot of clients, like now they're like 50 plus clients which go to the dispensary, get cancer, uh, being weighed, calculated body mass index and stuff like that, and they get medicine. So a lot of people are realizing after doing the workshops, people are realizing that this is just a disease. They need to be they don't need to be isolated from the other people from the community, and they are now happy. And also from the support groups, NGO comes in, educate them, give them work opportunities whereby they can now stand for themselves and feed themselves, rather than uh, in the past where people are having HIV/AIDS, they don't have money to eat well, they don't have money to travel to the district hospital to get their medicine. So that's the short impact I've had. It may seem short, like with talking, but it's a long because it's true, I think.
Mm-hmm.
Yeah.
And so, how has HIV/AIDS in the country of Kenya changed over the last few years?
Um, HIV was taken as a curse a long time ago.
Mm.
So when you had HIV/AIDS, then people would be like, this person is not a good person. That's why he has HIV/AIDS. He has a curse from God if you're religious, or if you're not religious, just as someone else has cursed this person. Um, so a lot of people were afraid to go and take the medicine because people were discussing them. People didn't want to shake hands with them. People didn't want to hug them. People didn't want to eat with them. People didn't want to shower with them. People didn't want to wear clothes with them. So things like that. But I think things have changed in Kenya with the introduction of community strategy, which was introduced by the government in 2009. So the government realized that there's a lot of clients in the hospitals. So how do we eliminate this or try to minimize it? So they come with a strategy whereby community members were educated or sponsored to go to colleges, study public health, preventional health, community health, and come back to their own communities and talk to them because in Kenya we speak English and Swahili as the national languages, but in some villages people don't speak English; they speak native language. So if you get people from inside their communities, it'll be easier to communicate with them because they know their culture, they know how they behave, they know how they say. For example, if you are a stranger and you go to a village whereby people have not treated water in their whole life and tell them, treat your water. People will be like, what are you saying? We've been drinking this water from our ancestors and now you're telling us this new thing. But if a person is from the community and tell them, look, I've also been drinking a water which has not been treated, but we need to change for these reasons, and just try to educate them. They listen better because they know this guy has passed these stages. It's not like a stranger whereby maybe they'll say, you have been drinking clean water, you get easy access of the water, and as water is hard and you're telling us to treat water. So it's better for the communities to talk to their own communities. So this really worked in Kenya because with the introduction of community strategies, the community workers were formed, and the community workers were educating community members, and now like almost every part of the Kenya has access of health knowledges like HIV, tuberculosis, malaria, stuff like that. So it's easy people to prevent diseases if they know information about it, rather than I want to try to prevent this disease, but I don't know which disease is this, how, what are the symptoms, things like that. So the community strategy has played a big part in try to maximize HIV transmission and other diseases like that. Yeah.
And so, what are the major groups of people that are contracting the virus in Kenya?
I think the youths a lot get the HIV/AIDS, but that was previously because youths, like in long time ago, like people thought like youth are easy to get the HIV/AIDS because they're not married. They just take any girl or boy they see around. But now it's not necessarily true because you get some married people who go outside their married, try to sleep with other people and take the HIV to their own marriage partners. Because if you're married, if you're married to one person, and then you have trust to that person. So even if that person goes outside marriage, sleep with other people, you will not ask her or him to wear a condom or anybody else because you trust that guy. So you just you do the sexual things because he or she is your wife or husband. So you don't need to be suspicious to him. So that has led. I think there was a time I was doing research, and from 20% was to it raised to like 38%, like married people getting a lot of transmission. And also there was one door-to-door immunization, door-to-door testing we did, and out of 100 couples we tested, just one couple had HIV positive couple, but the others were not positive. So just one couple was positive. So it's not necessarily true, but a lot of youths get the HIV/AIDS, And also the sex workers, they're in danger of getting the HIV/AIDS. Um, and people who still practice their culture, for example, the circumcision, the there's the needles where they put some holes on the ears and nose and mouth and stuff. So those things have also raised the number of HIV transmission. But as I said, from the community introduction of community strategy, people are being educated on how to still practice their culture, but in a safer way. For example, if circumcision, they use one sharp to one person, don't share it with other people, things like that. Yeah. So yeah, the most groups are the sex workers, youth, and also some married people who are not faithful to their parents or their partners.
Yeah. So one question that I get a lot in America as an HIV health educator and counselors, people always ask how did HIV originate? Where did it come from? What are your thoughts on that?
Um, I will give two thoughts because, like, I've been hearing two thoughts. One of them in college, they say that it originated from the monkeys, whereby not from necessarily monkey, but animals from the bush. So people were so they had the virus and were just transmitted to one of the other animals, but people start eating the bushmeat, so they contracted the virus from the animals, and then from the humans, the human one just transmit to each other. And also, as I said earlier, that some people also religious believe that HIV is a curse from God to those people who do sexual intercourse outside marriage. Yeah. So, but I believe more on the monkey thing. Yeah. Because it makes more sense from like monkeys to humans. Yeah.
Yeah. Okay. And so how what is the impact of Western medicine in eliminating HIV/AIDS virus from the community?
I think the ARVs have played a really good part in trying to minimize the HIV/AIDS dangers, because it's hard now to get someone with AIDS. You just get someone with HIV, but not with AIDS, because HIV is where you have the status like you have the virus, but AIDS is where you are suffering from the virus. So you are on bed, you are struggling, you are doing everything there. You are shitting there, you are pooing there, you are peeing there, all sort of things. But these things have gone now with the introduction of Western medicine and like a lot of workshop education being taken to the interior communities. You find now people, the medicine have tried to boost the immunity of those people, and people can live longer and also not face the AIDS state, just face the virus state.
Now, with the introduction of Western medicine, do you feel like traditional Kenyan culture has been lost in terms of medicine? How Kenyans would what am I trying to say? So like with the introduction of Western medicine, right?
Yeah.
Do you believe that traditional cultural medical practices, Kenyan practices, have been lost?
Not really. Like most of the practices we have is getting the HIV/AIDS. Like they support more of the getting of the virus than try to eliminate it. So,
like for example, give it like what's an example?
For example, like our practices are more of in a risk of getting the HIV/AIDS rather than stopping the HIV/AIDS. So, like for example, circumcision, the
Piercing.
piercing, and the blood contact. Like there's some tribes which drink blood, for example. So those are just cultures which keeps us on danger of getting HIV. But we don't have cultures whereby we would eliminate the HIV/AIDS. So the Western medicine have not in any way stop our cultures or try to spoil our cultures, because we don't have a medicine culture. The only medicine we take is for things like aloe vera when you have a wounds to put. So you just take direct aloe vera, put it there. Other medicine are just to herbal medicine to try to clean your stomach, try to boost your male
libido.
Yeah, that. Yeah, so those are just the cultures, the herbal cultures we have, but we don't have a culture where we used to treat uh, the HIV/AIDS. Most people previously were just like, this is just a curse, let that person die. Like we don't have a medicine culture of the HIV/AIDS. That's my thought. I don't know if you'd get other different thoughts, but that's my thoughts about the Western culture, Western medicine impact. Yes.
So you would say that the antiretroviral treatment is really helping the community.
Yeah. It has really helped. Because now like the government don't spend a lot of money in trying to uh, help people with AIDS now. They just use the money to buy the ARVs, which help the people to boost their immunity. And people, because your immunity is boosted, so like you don't die, like stay long suffering the state before dying. You just die like in a short days if you are ready to die. But it doesn't like affect a lot with the economy of the country, like trying to uh, help a lot of people with AIDS status, as just buying the drugs for the HIV clients. Yeah.
Now, I read an article recently that talked about how in the coming years, especially like U.S. government, the aid to African countries in terms of HIV and AIDS will significantly decrease, right? Because we believe that African countries should now be able to develop their own AIDS strategy and pay for their own medications for their people and things like that. So how would that impact the AIDS virus within the country if that were to happen?
I think that would just cost the government, because the strategies should be open now. Like people should know how to deal with HIV/AIDS, because it's not a new thing. It has been there, so people should have the strategy with at the moment now. So it'll just cost the government a lot of money to buy the drugs. But I don't think it'll be hard to come with a strategy, because it's not a new thing. But a lot of money will be going to cater for those stuff.
So what needs to happen in order for HIV/AIDS to really be eliminated, or is that something that do you think that we can have a world free of HIV and AIDS?
Yes, we can. Everything is possible if people become responsible of themselves. Like use a barrier. Why risk yourself with a new partner you don't know, you have not been tested, and just uh, do a sexual intercourse without the barriers? Use the barriers. If we use the barriers, there's a chance we can live without transmission.
If you use a what?
A barrier like a condom.
A condom.
Yeah.
Okay.
So you won't get HIV/AIDS, for example, if you become faithful to your partner. Not just being faithful, but faithful to uh, a negative person. So then, even if we can't stay with no HIV/AIDS, but we can stay with no new infections. Yeah. So like if you follow what health workers tell us, then there's a chance we can live with zero infection. but it'll take time to be with world with no HIV. Like it will be there, but we can try to say we need zero infection, HIV. Then it's possible to get that, because if people become responsible for their lives, then yeah, we can be zero infection, HIV infection wide. Yeah.
So like I'm seeing this kind of like this clash in like culture and like no new infections, because there I know from talking to certain people that there's certain like tribes or villages where one man can have multiple wives, right?
Yeah.
So how do we incorporate themes of like being faithful or being sexually monogamous when one person can have many different partners?
Yeah, that's the issue, because like Muslim can marry more than one person, and Maasais and other tribes can marry more than 4 person. Like some people marry 11 wives. So, like I said, it's the responsibility of every person to like think of himself or herself. Am I getting myself into risk here? So if I'm not saying I can change the culture, say just marry one wife. It's impossible to do that.
Yeah.
But if we keep on educating people, keep on doing workshop to uh, specified tribes, like if you say like this tribe marry more than one wife, then we do workshop. We say, look, you can marry, like your culture says you can marry more than 4 wives, but do this and this and this. Use maybe test your partners before you marry them. Things like that. Like try to follow a better way to do those stuff than doing what we used to do. Like just go, I pick a girl, I'm gonna marry you. You have not tested that girl. You say like things like that. But it's really hard to change people's culture. Not all cultures are right, but it's hard to change them now, because people have been doing those cultures since like 40, 50 years ago or more.
Yeah.
So it's really hard. But what we can try to do is just educate these people on risk of like unprotected sex, those transmission ways, things like that. Yeah.
So I think what's important is really finding that connection between allowing people to engage in their cultures, but also um, this collaboration between Western medicine and culture. It's like saying, oh, like you said, you can practice your culture, your traditional culture, but this is how we keep you safe within the culture. You know, for example, like you said, if you have multiple wives, test your wives first, right?
Yes.
But what about rural communities, like for example Shimoni, right?
Yeah.
How are people testing there? Or like in Maasai, in Maasai land is very rural, very nomadic. How do people get tested there? You know, are there mobile units, testing units that go out there and test everybody once every 3 to 6 months, or how does that happen?
I think the government has really done a good job, because every place, even if it's a village, for example, if a dispensary at Shimon, and I'm sure there's a dispensary. So even if it's a really rural area, at least there's a dispensary.
Okay.
So this is the work of the health workers or community workers of the administration to try and collaborate. For example, if there's a dispensary which doesn't have a VCT, then they can ask the VCT from the government to be posted there. Another way is try to ask NGOs to try and come up with a mobile VCTs. But almost every village in Kenya has at least a dispensary where it's accessible, like you can access a VCT easily. Even if you there's no VCT, but they can test. At least they can test your HIV/AIDS if you go and say, "I want to test my HIV/AIDS." Yeah, yeah. So
And so my last question is, um, what's next? You know, for Kenya, in terms of really getting it down to zero new HIV/AIDS infections.
um, keep working hard.
Mm-hmm.
Um, like myself, I believe nothing can change without information.
Mm-hmm.
So the more information we give the citizens, the local communities, the more chances of preventing these diseases we have.
Mm-hmm.
The more resources we have to do this information, the more the information will be a perfect one and very understandable, and hence the prevention of the diseases. So I think the government should put uh, Kenya should put more emphasis or more power or more energy in this community strategy because it's really working uh, perfect at the moment. Like most of the diseases now, you won't hear them in the rural areas. For example, like Ashimani used to be a cholera village. Every year there was a cholera outbreak, and we lose like 50, 60 people dying from cholera. But since 2009, with the community workers being started there, health groups being formed there, we haven't had that case so far. So
Cholera.
yeah, so these are things government should put more emphasis on those and try to also, because these community workers are doing volunteer work, they're not paid. So if you get NGOs or government stepping in and try to give them, like starting with a small thing, like you can't just pay them like maybe 10,000 a month, but try to give them something small. They can buy maybe soap to wash their clothes, or they can buy credit to call the clients they have, trying to, those things, like try to
An incentive.
yeah.
Okay. Well, thank you, Kopa,
Yeah, you're welcome.
for your words, for your thoughts, for your information. And look out for some more interviews moving forward. This is one of many interviews that I'm doing just to really allow for people in America to really understand the global HIV/AIDS um, pandemic that's happening and really get into the thoughts of the people. So thank you for watching. Have a good one. Bye.
Bye.